Okay, I appreciate it. It's 1 o'clock, so we'll get started here. I want to thank all the members of the media for taking time to join us today and for this media availability. And just want to emphasize the scope of this opportunity is to discuss our plans for a phased-in approach to managing the reopening of athletics training facilities for voluntary in-person student-athlete workouts. There are many questions about the fall sports seasons and other important topics, and there will be a time for those questions. So we ask that you please respect that today to use this time well about the reopening plans. We're pleased today to have Mark Harlan, Kyle Brennan, Trevor Jameson, and Dr. David Petron presenting today, and all will be available for questions after the plan is presented. Please remember to keep your mics on mute and cameras off from a bandwidth standpoint, and then unmute when it's your time to ask a question. I will, after the presentation, when we get to the Q&A, I'll let you know when it's your turn. Just unmute and ask your question. With that, I'd like to turn it over to Athletics Director Mark Harlan.
Thank you, Paul. Appreciate you. I also want to thank all the members of the media that are taking a few minutes today. Appreciate your interest in our program as always. I thought what I'd do before I turn it over to Trevor and certainly Dr. Petron and Kyle is just kind of set the stage for where the athletic program is right now. Traditionally, when school ends in May and the summer begins, that on any typical year, that begins our summer volunteer workout program. And if it was last summer, for example, many of our student athletes would be here, they'd be enrolled in summer session 1, and they'd be utilizing the facilities all over in our athletic campus region to work out strictly on their own accord without their coaches present. So as we have now, fast forward to this year, we're now in that period, and pursuant to the NCAA's allowance of reopening athletic facilities as of June 1, and in following the guidelines of the Pac-12 conference, June 15th being the first day allowable, Utah will begin the process of reopening our facilities and having our student athletes in phases that will be described shortly return to this voluntary session. So again, it will eventually fall similar to what we've seen in prior summers. So none of this today is revolving around any team practices or any type of organized activity with their coaches. This is solely activity on their own, as many of them continue with their online academic classes that they're currently enrolled in. This whole process has been incredibly collaborative. We've had an unbelievable reopening team led by Deputy Athletic Director Kyle Brennan, and with the incredible service of Dr. Petron, our fabulous team physician, and certainly Trevor Jameson, our head athletic trainer. We've also been working very collaboratively with the Pac-12 and their medical group, which Dr. Petron will describe shortly. And we've also been working with our students along the way. Many of our students are anxious to come back and work out in these incredible facilities that we're blessed to have. And of course, our obligation is to do it in the safest possible manner. And that's what we plan to do. So without further ado, I'm going to go ahead and turn the program over to Dr. Petron, who will offer some comments, and then we'll get into a quick slide presentation. Doctor?
Thanks, Mark. Trevor, you want to put on the first slide?
Yep.
I'd like to just give an overview of how we got to this point, and then I'll turn it over to Trevor to go through some of the specifics. But Mark's right, it has been a collaborative effort, not only at the University of Utah, but within the athletic department, or within the Pac-12. We've had representation from every team in the Pac-12, and this has gone through the Student Athlete Health and Wellbeing Board, as well as the COVID-19 Task Force. And there's been a lot of input from a number of experts, including infectious disease experts, to get to this point. Keep in mind that the number one thing is our guiding principle is the health and safety of student athletes and staff. And everything that we do, the protocols that are created are in accordance with the state and federal NCAA and Pac-12 guidelines. Also keep in mind that this is a fluid document, and what we say today could change at any point as we gather new information, emerging evidence, and experience that we gain through and more evidence from the public health department. Also keep in mind that we've worked closely with our local health department to come up with this plan. And I want to thank Angela Dunn, who's been a valuable resource, Spoke to her last night, gave the final details of the plan, and she feels like it's a very good plan, very reasonable plan. Part of what we do is really dependent upon the institutional leadership. So we must operate in accordance with the local and state public officials with regard to return to campus, return to practice, and return to competition. And in the end, the institutional and government leadership will determine who can participate in, assist with, and watch student athletes practice and competition. All of our athletes, when they return, will be tested. Everything that we do will be on a volunteer basis. So they will get PCR testing as well as antibody testing. And this is not unprecedented, as these are essentially asymptomatic athletes that are being tested. And some of this is being done around the state already, where you have targeted asymptomatic testing for populations that can't socially isolate. So there's been instances where the state has tested, say large businesses that can't socially isolate, so that they can return to work in a safe manner. And that's the whole idea that we want here when we test asymptomatic athletes. We think it makes our community and our campus healthier as a whole. So if we can know who might have the virus, who may have been had the virus in the past, we think it just helps the entire campus. All of the protocols that we follow right now, again, may change as things go on. So our main goals will be to create a safe and manageable return group of students, athletes, and staff. We'll decentralize potential areas of congestion and cross-contamination amongst team and student athletes. And what that means is these athletes will have appointments to use the facilities so that we don't have one team crossing over with another team, that we can keep the appropriate separation. We'll have temperature checks and daily symptom questionnaires. We'll have hand sanitizers in all the facilities in multiple areas. We'll have spacing during workouts. And they'll take these assessments and these temperature checks on a daily basis. We want to create a contact tracing system within the department that allows us to follow the athletes on a day-to-day basis, and they'll have an electronic questionnaire that they'll fill out on a day-to-day basis. So that's kind of just the overview. And then Trevor, our Director of Athletic Training, will go over some of the specifics. Trevor?
So as we put this plan together and we're looking at phasing in our student athletes, the obvious question becomes, why are we phasing this in? How are we doing this? And just to start to understand that, we need to talk about low risk versus high risk exposure. A low risk exposure is defined as being within 6 feet of someone who is infected with COVID for less than 3 minutes. No physical contact. Maybe you're working in a group with someone, but as long as you're maintaining that distance and so forth, you're okay. So if we have a low risk situation or exposure, the symptomatic person will be removed from the rest of the group, but the rest of the group will be able to continue to work as we continue to monitor their symptoms on a daily basis. A high risk exposure is going to be something where there's contact, again, less than 6 feet, but maybe greater than 3 minutes. Maybe there's direct exposure. An example is being coughed on, or there's physical contact. Something like sharing equipment, like a ball, would increase a high risk exposure incident. If we have a high risk exposure incident, obviously the person who's symptomatic will be self-isolated, as will the rest of the group, and all will undergo contact tracing and testing in that group. So as we define those two things, we are trying to create a safe environment, and we want to try to create only low risk exposures or less as we return these student athletes back to our facilities. So a lot of the things that we have in place as far as working groups and times and schedules that Dr. Petron alluded to are to help create low risk exposures or no risk. This is important because it's going to help us to establish a baseline with our department and as these kids return. It also prepares manageable working groups that we can maintain these exposure levels. When we do have a COVID-19 positive test, we have groups that we can pull this person out of and not have mass exposures. Another important thing is we're hoping it will establish a culture of compliance and social awareness, because this is really the long-term benefit and the long-term solution is to practice good cultural awareness and hygiene practices and those things, not only here in our facilities, but out in the community. After about 14 days of people being together, as we watch these groups work and we have good compliance and good outcomes, we can start to allow them to get back to more of their regular practice, which might include some high-risk activities. So as far as the phase-in, we'd like to turn it over to Kyle Brennan, who will run through this phased-in chart and kind of explain the phase back.
All right, thank you, Trevor, and thank you, Dr. Petron. It's a pleasure to work with you guys. Both of them have been with us for a very long time. Trevor, all the way back to Majerus. So I've got great people working on this, and we're excited for the opportunity to get our student athletes back here working out. So as you can see from this chart, we would start back on June 15, and the sports that we would welcome back are football, men's basketball, women's basketball, gymnastics, volleyball, and soccer. And as Trevor has mentioned, it's going to be a phased-in approach that will occur over 3 weeks with those sports. First, we'll start with in-state returning student athletes, have them come up to the facilities, get checked, do all those things that Trevor talked about. Then we'll go to out-of-state returning student athletes, and then we'll finish off with all of our new athletes. I just want to make a note here that this is all housing dependent. So we're tracking where our student athletes live and who they're living with, and making sure that they're in a safe place and not crashing on a friend's couch. So we got to make sure that our student athletes are in a safe place to live for this to work. And then we move from those sports that we talked about to a look-in period on June 29th. And on June 29th, we're going to look at the first 3 phases that we had and evaluate how it went. And if our student athletes are safe and we've had a good experience, then we would move on to phasing in the other sports, which would be similar, having in-state kids return week 1, out-of-state week 2, and then the remaining athletes on week 3. And at the very end, August 24th is when we get back for the fall. And so we'll bring all of the student athletes back at that time who may not have come back for voluntary workouts, and we'll be back ready to go and compete in the fall.
All right, so thanks, Kyle. So what's going to be expected when they return for these phase-in dates? The first thing that we're going to do, like we do every year, is we do our physicals. Some additions to this year, obviously, we have a COVID screening form that just gives us some detail of kind of where they've been, what their interactions have been over the last couple months, just to help us understand a little bit. And as Dr. Petron alluded to, we will do antibody testing, and we will do a COVID test for all of our student athletes to get a baseline and to look at what's going on with things. Also, we will be testing staff, and initially it will be the staff that are involved with the training of our student athletes. Want to talk a little bit about the symptom check-in point on campus. We'll have one at both of the facilities that we're going to be using, and the student athlete will arrive and we'll answer some questions, get a temperature check. We are going to use an electronic survey to help streamline the questioning. Once they get through the questions and the check, then they'll get a wristband that will allow them to go into the facilities. And we are going to be escorting these kids in groups to their facilities. And again, we're trying to limit the crossover between all of our athletes. And so with the sports that were listed, they're all going to have their own satellite weight rooms in conjunction with their playing facilities, so that we don't have any crossover between all of these groups. And all of these things will be by appointment. And so when they show up, they'll show up at their right time. They'll be escorted to the right place, and that will help reduce an exposure. And so if somebody comes at the wrong time, they're not going to be allowed to come in until their time is up. The last slide that we'd like to share with you is just to help answer a question about what happens when we have someone who's sick. What the student athletes are instructed to do is they do not come to the facility. They call their athletic trainer, let them know what's going on. The athletic trainer will consult with the physician, and then at that point, if it's felt that they need to be tested for COVID-19, they'll be sent for testing and isolation. Then at that point, we're obviously going to look back at our contact tracing, talk with our student athlete, and anyone who may have been involved in a high-risk exposure, we will follow up with. And just to kind of give you an idea of what happens with high-risk exposures is that necessitates self-isolation or quarantine at home for 14 days. Or what we can do with testing is shorten that time period by having them self-isolate, test on day 3 and 5. If both of those tests are negative, then we'd consider them negative for COVID and they can return to activity. That's all I got.
Thank you very much. Before we go to the Q&A portion, Mark, did you have any transitionary comments here?
I would just add that my appreciation for this incredible team that has been working for quite some time to get us to this point. We all very much miss our student athletes. We're excited, as I said in my earlier comments, to have them back. And you can imagine that our #1 priority will be their safety. And so we're very confident with our plan. We're most confident with the people involved with the plan. So our decision making has been and will continue to come from this group. I also want to again stress that the Pac-12 has been a big partner in all of this, including not only the Pac-12 Council, but also the Pac-12 student reps representing the various different schools, particularly as it came to the pandemic policy and having June 15th, the availability for each school that can to do that. So appreciate everybody's time on this today, but certainly here to answer any questions.
Thanks. We'll begin with Josh Furlong from KSL.com. And if you want to direct it specifically at one of the individuals, please do. Go ahead, Josh.
Yeah, Mark, this is Josh. I just had a question. How much of what you guys have done falls in line with what the Pac-12 does in terms of the timelines and everything? I know you've talked with them and everything, but does this timeline fit well with maybe what other athletic departments are doing around the conference?
Well, Josh, in terms of the timeline, I can't speak specifically to what other schools are doing, if they're going to start on June 15th or later. So I'm not exactly attuned to speaking to that specifically, but I will say that the thoughtfulness of all our member institutions has been pretty consistent as we've shared best practices and plans. And certainly Dr. Petron can give a little bit more insight on the group that he serves on with all the medical professionals. Dr. Petron, you may want to mention that.
Yeah, I can't give a timeline for other schools either, but we'll all be in compliance with the Pac-12 document that's out. And this is a as strict or stricter document than we've had even from the local health department. So I think a lot of it will depend on the local community, but the criteria will never supersede what happens on a local level. So we might be a little bit ahead of some other states, but I can't speak for when other schools are going to open.
Thank you. Our next question will come from Josh Newman of the Salt Lake Tribune.
Hi, Dr. Petron. How are you?
Good, thanks. How are you?
I'm well, thank you. If somebody does test positive, have you identified a dorm or a spot on campus where that person would quarantine for 14 days?
We have. Trevor, can you speak to the specifics of that?
Yes, I can. Yeah, depending on where our student athlete lives, we have some different approaches that we can do this. We certainly have a way to isolate our student athletes and also be able to isolate those that are maybe living with that student athlete. One of probably the #1 thing that we may do is obviously consult with parents and family. And if someone's local here, we'll definitely have that conversation with them and make sure that our student athletes and parents feel comfortable with the situation that we have for their isolation.
Thank you. Our next question will come from Ross Terrell with KUER.
Yes, I think this may be best for Dr. Peacham, but can you talk about why you chose the antibody test when there's a high rate of false negatives, and that usually comes after a person may have had it, as opposed to testing everybody for the disease when they return?
That's a great question. There are some issues with the antibody test. Most of it is because it has good specificity, but there can be false positives. And the problem is the prevalence is so low. It's only like a 1% to 2% prevalence. So even though the test may be good, the false positive rate can be high. So the main reason we want to test individuals is to see who maybe has already contracted the virus at some point and has been asymptomatic. But also the main reason we want to do it is to do further cardiac and potentially pulmonary testing on those who have tested positive. We're going to start the test with a qualitative test, meaning it would just be a positive or a negative test. And then if that test is positive, we do a further test to make it more accurate test by doing a quantitative test or a titer. So we'd know the titer of the antibodies, both IgM and IgG type antibodies. So if we combine those two tests and it helps us pin down who might have been positive in the past, we feel like we can do further testing for the protection of the athlete, specifically cardiac and pulmonary.
Thank you. Next, we'll go to Chris Camrani from The Athletic. Chris, unmute.
Sorry, guys. This is probably for Mark and Kyle. Is there a plan in place should some student athletes in various sports not feel comfortable participating this fall? And if so, is there like a contingency plan in place? Would that affect the status of their scholarship?
Yeah, I'll take that. And just a reminder, we're talking about right now. And right now is the volunteer period. And as we see in any typical summer, some kids take advantage of this volunteer program and some join us when they can. But to the overall, idea of your question is we're going to work very closely with any student athlete, their families that are not in a comfortable place. To date, we are not managing that. It has not come up, but we know as our students return, we'll work with them. And like we do all the time on a daily basis, issues come up with any individual young person and that we manage it accordingly. And we see no reason to do that any different now. Their ability to feel comfortable is very, very important to me personally, to our staff, and we'll work with anybody that's not comfortable yet. I should also say that we've shared all of this with the student athlete parents earlier today. And so we're just going to be very transparent and open to our plan, and we anticipate further questions, and we'll be fielding those as they come.
Thank you. Our next question will come from Dana Green, ABC4.
Hi, this question is for Mark. Utah fans' biggest question, obviously, is, is this football season going to start on time? I know this is just phase one, but can you comment at all on how significant a step this is to getting the football season to start whenever it does?
Dana, you're right. This is an important first step of many that are going to be part of the process for us to begin our fall sports in the fall. And that's why it's important that we do it the right way, and our students do it the right way, and everybody. So obviously it's an important first step. And then the next step, of course, is the more organized team practices that will be later on in the summer and then leading up to the games in the various sports. But all of these things line up, and if the data continues to become more positive, as we're seeing in our state, and if everything goes the way that we hope that it will, then I remain confident that we'll be able to start football. But there's a lot of days and frankly a lot of months between now and then.
Thank you, Mark. We'll go back to Josh Newman, Salt Lake Tribune.
I think this might be for Trevor or Dr. Petron. Salt Lake City is currently remaining at an orange threat level. There is some strong talk of it dropping down to yellow, which would be helpful. My question is, are these measures and bringing kids back, is this dependent upon Salt Lake City getting to and staying at yellow, or could this go forward at orange?
I can take that one. The all the steps and procedures that we have in place right now are conforming with phase orange of the state. So as we look at what the state allows for this level, we're meeting that, and we plan on doing that for several weeks. Obviously, whatever color the state is, we're going to follow those guidelines. So to answer your question, we are in compliance with that, and the color of the city that we're in will help dictate our plans.
And next, we'll go back to Chris Kimrani.
This could be for any of you guys, so feel free to jump in. But can you give just kind of a loose timeline of when this plan started? I know you guys have been planning for everything for the last 3 months, but when did this specific plan really start to take place with, this brain trust starting to get this off the ground?
You want to walk them back to when you pulled everyone together?
Yeah, so I think like a lot of you, the days and weeks are running together when you're at home all the time and you're on a million Zoom calls. But from my recollection, it's been about 4 weeks. And, what I can tell you is that Mark came to our group and said, we want to get our student athletes back when the conference allows it. And we want to do it in a safe way. And we want to be a leader in this space within the conference. And so really started early to get ready and really think that we've been a leader in the space within the conference.
Let's go back to Josh Newman. Next question.
If this was addressed already, I apologize. I don't think it was. Are there any special measures in place in terms of cleaning and disinfecting whatever facilities might be used by student athletes during this?
I guess I'll take this one too. Yes, there are. Obviously, the athletic training room being a healthcare facility also always has a very high maintenance schedule. But we have worked with our custodial here. We have looked at the CDC types of cleaners we're using, following the guidelines of cleaning facilities that the state has outlined, as well as what CDC has. So there's been a lot of forethought and preparation put in to meet all of those guidelines.
Thank you, Trevor. We'll go back to Josh Furlong, KSL.com.
Yeah, you talked about how you wanted to isolate the various athletic department or the sporting teams and trying to keep them in the same dorm areas or at least know where they're at. Is there a situation like where you're able to kind of restrict these kids? Obviously, this is voluntary. So are you able to kind of limit who they go visit or who they see or what kind of interactions that they have? Like, are they supposed to stay on campus or what's that situation like?
Well, I can jump in, and Trevor can as well. But I would say that when it comes to our student athletes, they're adults as well. They're young people, but they're adults. They have lives outside of here. Our job is to do everything we can to educate them, to put them in the best situation possible to handle these situations when they come into them. So whether they're shopping at a store, or they want to go work out somewhere else, or they want to go for some entertainment at a movie theater, our trainers and doctors will sit down with them and advise them on the safest course of action to live their private lives outside of when we have them. When we have them here, we're definitely going to monitor and take care of them, but we do send them on their way, and a lot of student athletes live off campus. So while we don't control every aspect of their lives, we do everything we can to educate them, put them in the best position possible to be safe.
Josh Newman, go ahead.
Mark, I know that these things are voluntary, but have members of coaching staffs for football or any sport really, have they been given the all clear to maybe re-enter their offices or re-enter their facilities on campus?
We are working on that piece as we speak. We know that the first kind of wave, so to speak, is the senior management team. We came back to work in the office. We've all been working, of course, but we're back in the office this week. The next phase will be the group that's going to be around the student athletes that will be returning, as we've just outlined. Very limited coaches involved in that. Beyond that, Kyle Brennan is also leading the next phase of this will be our all staff and coach return in pursuant to the university's rules and regulation. But we are going to have a very limited group. But that group at first will be the ones that are doing the work to make sure that this voluntary piece goes the way that we've been planning it. Kyle, I don't know if you want to add anything to that.
No, I think that sums it up.
Thank you. Really appreciate everybody's questions and thanks for all the insight. That does conclude our session. I don't see another indication of a question. So I'd like to wrap up now, unless anybody has any last comment from Mark.
No, again, thanks to all of you for your interest. We felt like it was very important to be as transparent as we can, and just want to reemphasize what Dr. Petron and Trevor said. This is a living, breathing document, and as data comes at us, it will be adjusted accordingly. And it's very important that we continue to listen to our medical professionals. I know myself and Kyle are so grateful to have the work output to be able to make decisions for the department. So I want to thank them both. And obviously, as the summer progresses and we have more information, certainly make ourselves available for another gathering such as this. So appreciate it.
Great. Thanks to each of you. And again, thanks to all of you in the media for joining us and for your coverage. Thanks a lot. Have a great day.